So today we will talk about the examination of the diabetic foot. The steps involved in the diabetic foot examination is inspection and palpation. In palpation, we check the vascular supply up to lower limb, and we also do the neurological examination of the lower limb. Before starting the examination, first of all, you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of examination to the patient, and expose the patient properly. In diabetic foot examination, we expose the patient lower limb up to the mid thigh. So the first step in the diabetic foot examination is inspection. In inspection, we assess the general hygiene of the foot. We look for any skin dryness. We look for any prior importation done. We look for any superficial fungal infection and note any visible ulcer or the skin cracks present in the foot. We also look for any gangrenous tissue present, and similarly, we also note for any visible bone or the osteomyelitis. The second step in diabetic foot examination is palpation. In palpation, we assess the vascularity of the lower limb, which is done by checking the capillary refill time and checking the distal pulses of the lower limb that include the dorsal pedis artery pulsation, medial malleolar artery pulsation, and the popliteal artery pulsation. The second step is the neurological examination of the lower limb. In neurological examination, we check the sensory sensations of the lower limb and all the dermatomes that include the crude touch, which is done to a pinprick, the pine touch, which is checked with the help of a cotton, and vibration. So the vibration sensation checked with the help of tuning fork, and the proprioception. So the proprioception is checked by asking the patient to close his eye, and we move his great toe up and down, and we ask for the position of the great toe. And similarly, we also check the pain sensation, that whether the pain sensation are intact or not. Similarly, we also check the ankle reflexes to assess whether the ankle reflexes are present or not. Similarly, we also check the gait of the patient by asking him to walk, and we note the gait. And similarly, we also check the shoes of the diabetic patient, whether he or she is using soft or hard shoes. And at the end, we call the patient and say thanks to the patient. So it was all about the examination of the diabetic foot.